you said that people should not take your medical advice.
Yeah,
That's your position?
Yeah, absolutely. People should not be taking medical advice. I'm somebody who is not a physician, but they should also be skeptical about any medical advice. They need to do their own research. You know, you're a mom. If you're a mom, you do your own research on your baby carriage, on your baby bottles, on your baby formula.
But they don't have medical degrees, obviously. If you're a mom and you're looking at what science has been tested, they trust their doctors and their pediatricians.
One of the responsibilities of living in a democracy where physicians and every sort of expert are subject to all kinds of biases. One of the responsibilities of living in a democracy is to do your own research and to make up your own mind.
So that's your message to moms or to anyone, is to do your own research?
I would say be skeptical of authority. My father told me that when I was a young kid. People in authority lie. And we've seen a lot of that in our country. And people in the media lie. And people need to make their own judgments and be skeptical and maintain their capacity for critical thinking. And that was shut down during COVID. And the media was complicit in that.
Disagree on that last part. Secretary Kennedy, thank you for your time.
Another day, another RFK video. RFK has been making the rounds. As you saw from the intro, he checked kind of Caitlin Collins on the fact that the media was complicit in pushing a certain narrative that we wanted all of us to believe, right? And the Senate recently reviewed some of the findings that they had for a lot of the COVID vaccines, and let's say it wasn't pretty for them, right? And many people are starting to notice this pattern, right? That our healthcare system is very reactive, not proactive, right? Almost like a catch-all solution, throw drugs at it, throw drugs at it. And it's almost like, okay, come on. Like, this drug stuff can't be the only solution to address these problems. And what MAHA is really doing is asking more like, hey, how can we prevent a lot of this stuff from happening instead of just reacting to it? Because at the end of the day, it seems like the reaction is more profitable than the prevention.
Absolutely, Jackie. You know, scientists have been waving the flag for years saying you've got to look at this body of scientific data. And the modern medical establishment really has been disconnected. We've been so busy focusing on treatment, on billing and coding in a high throughput model. We've got to stop and ask ourselves, should we be focusing more on school lunch programs, not just putting every kid on Ozempic? We've got to talk about food as medicine and gut health and the microbiome. We've got to talk about environmental toxins that cause cancer, not just the chemo to treat it. And maybe we need to treat more diabetes with cooking classes, not just throwing insulin at people. This report is a fresh new approach that really calls for a transformation of our healthcare system from a reactionary system to a proactive system. So I could not be more excited about this report. There are no sacred cows. It talks about 70% of the diet being ultra-processed. It talks about pesticides, microplastics, natural light exposure in children, sleep quality. Remember, Republican, Democrat, and independent moms showed up in high numbers to vote for President Trump over this very issue.
And this is how Democrats catch themselves on the side of not doing what's in the best interest of the American people, right? Pharmaceutical companies, big food, all these people, they pay Democrats exorbitant amount of monies during their campaigns. And it seemed like this is why they are so resistant to the efforts of RFK and many people part of the MAHA movement that wants to change the structure, change the incentive structure within our healthcare system. RFK, in the intro of this video, mentioned how you should question the experts because at the end of the day, it's a fallacy of authority. People can misuse their position of authority to push unsubstantiated claims for their own personal gain. They could finagle with methodologies to push a worldview that they want you to buy into for their own power and leverage. Because at the end of the day, no matter how much of an expert someone is, they're still human. Humans still have bias, and bias can still corrupt the product, service, or information someone is feeding you. And this is one of the things that I've been pointing out when it comes to climate change. Climate change have the same issue, how they only put on pro-climate change people voices, but they don't put the pushback. They don't put the resistance. They don't put the opposite or the counterpoint as much attention. And this is some of the problems that we have with the current distribution system. And I think this is why corporate media is so threatened by online media, because they can't control what information people have access to and don't have access to. Imagine being upset about a plan to remove toxins from our food, because based on the report based on the MAHA report, Trump, I made a video, Trump talked about it, how this has to be something that's been introduced recently from a historical standpoint into the environment, and that's causing all these new outcomes. And we have to get to the bottom of what's causing those things. But right now, the vaccine industry, I think it's like $420 billion. The COVID vax, the booster stuff. Like, me and my wife just finished talking about how boosters just recently became a thing. When I was growing up, I never heard about boosters. And the point was that everyone has this understanding that if you got vaccinated for something, you were fine. It's the people who didn't get vaccinated for this stuff should be the one that's worried. But a lot of these outbreaks we've been hearing about recently is that these people who have the vaccine for these things that the vaccine is supposed to prevent, they're the ones being most affected, while the person who didn't get vaccinated for it is fine. Make that make sense. And this is the kind of thing, these are the kind of questions that the medical experts don't want answering, because it could damage this framing or this kind of worldview that they've been pushing on us for decades, that many other countries have already banned simply because they don't like the guy banning them. Make it make sense. And I always talked about it in this channel that, when some people say, "Oh, Kenny, I don't understand how you despise the Democrats so much when Republicans can be guilty of the same thing." And I think the number one reason is the fact that Democrats don't want to acknowledge reality. That's their biggest downfall. That's their biggest problem. They don't want to acknowledge reality. They made common sense a right-wing thing. Make it make sense. And they are Pikachu face surprised why many people don't believe them, don't trust them, right? When a lot of these experts who happen to be politically aligned with their worldview are pushing these concepts and these sayings, it's so ridiculous. And this is how they get exposed time and time again. And I just want to go into this little quick kind of thread. America's healthcare system is broken and is about to face a massive reset. And I think this is what many people wanted. Taxpayers have been robbed blind, all while the root cause of their health problems were entirely ignored. The MAHA report exposed it. Now Oz and McCary are fixing it from the inside. But it's what Oz vowed to do about illegals draining Medicare that lit up fire. There's something that Oz brung about, and I want to play this clip. I don't want to squander it, but he talks about how illegals are actually draining the Medicare system, and it's what's kind of at the detriment of the American people. And this is one of the ways that Democrats find themselves at odds with American interests, because when you find out, hey, illegals are draining our system at the detriment of the American people, what the Democrats say? Shut up and take it. And that's not a messaging that's really going to resonate with the American people. And you now get an insight on some of the things that make the Democrats so unpopular in the American politics in 2025. Let's take a look.
The message for me is a very simple one. In every scenario I have seen, and I've seen, I think, most of them, we are increasing the amount of money we are spending on Medicaid, because we do have to support Americans who are most vulnerable. Great societies are judged by how they take care of people who are vulnerable amongst them. That stated, we have to make the program sustainable. We have to protect it. That's what the Republicans are trying to do. President Trump has said over and over again, publicly and privately, he wants to love and cherish these programs because he wants to love and cherish the people in them. But to do that, you have to make sure, for example, they're not providers. If you don't pay providers, right, they do it for free, let's say, they can do that for 1 in 7 patients. But if you say, hey, listen, half your patients we're not going to pay you for, we're going to make programs that don't reimburse you, that doesn't work. Now providers begin to flee, and now we don't have enough, for example, mental health providers in rural parts of this country. There's much we can do as a country. It's a shared responsibility. We have to do it together. But the buck stops here. We've got to clean up the system. We're not paying $200 million for housekeeping anymore a year. We're not going to pay for illegal immigrants in states that are submitting those claims. Why should people living in Mississippi or Texas or Florida be paying for illegal immigrants getting health care in California? Yeah. As a nation, we need to be aligned to make this work.
And I asked the Democratic Party again, this is what America First is about. Prioritizing the people that put you in power. Prioritizing the people that fund your administrations, your government. Putting them at top of mind, not using them as essentially slaves, tax slaves, to embezzle and bribe foreigners coming into this country, and you give them cash and prizes at the expense of the American people. And this is the difference. This is why I said Democrats, this is the reputation Democrats have for me. When you ask me, black conservative, how can you vote for the Democratic Party? A black lib will tell me or ask me. I'll tell them because it's simple. The Democrat Party has always used the same tactics they've been using ever since the creation of their party. They always need slaves to take advantage of to help or enrich someone else at the other person's expense. You use the American taxpayer almost like a slave. This is the Democratic Party. I'm framing it correctly. Can you make sense of the fact that Florida, Texas, all these other states, all these Americans are paying into a system for Medicare that was supposed to be for American citizens, and then California, in their system, they said, "Oh, we all residents can take access to Medicare on our state," and you letting people who broke our laws come into this country and get the fruits of our labor. We work, they eat. We work, they get free health care. Huh? Make that make sense. Justify that to the American people. We contribute tax dollars into a system that's supposed to be for the retirements of American citizens, and then you find out half of illegals that come to this country are taking advantage of it when they pay less money into it compared to someone who was born and raised in America. Can you justify that? Democrats cannot. And this is one of the problems that lead into the video where I talk about how Democrats are desperate to win over young men. It's hard to explain that to a man. Oh yeah, you work, you do all this stuff, you take all this sacrifice, you take all this risk, and you get nothing for it. Leftists want an unreciprocal relationship. And this is the problem that American First has exposed about the Democratic Party, is that they want to take advantage of people at the expense of other people's time, resources, and tax dollars. Waste, fraud, and abuse. And now they're crying, oh my God, they're trying to cut Medicare, without giving proper context, without giving an honest depiction of what the sentiment or what the reasoning behind the Republicans cut for the stuff in the first place. And this is how Democrats always come across disingenuous. This is why many people feel like they get tricked into voting for the Democratic Party, because they do ish like this. But, I digress. I want to play this clip real quick from the FDA commissioner, and then I'll wrap up with my final thoughts.
And when we talk about payment reform, we're really talking about how we fund our broken healthcare system. This report talks about how we fix our broken healthcare system by getting at the root causes and the ultimate issue that we've not been talking about, and that is the health of the population. When you have 40% of our nation's children with a chronic disease, that portends for a very expensive future healthcare system. We can address it. There are many things that we can do, even at the FDA, addressing food, which many people forget is the first letter of the FDA is food. It's not just drugs.
Exactly. If Americans eat healthier, right, we exercise, we can limit a lot of this stuff, but it will be less profitable. Because at the end of the day, I said this a long time, but like many health experts say, when I go to a hospital, it's boring. People are bored with me. They're like, damn, this guy's healthy. Nothing's wrong with him. In my head, I think about it like I put myself in their shoes. If I was trying to sell a product and my customer legitimately, objectively, and logically doesn't need my product, how do I make money? Ask yourself that question. Ask yourself that question. If you're a medical company, how do you make money with a healthy population? Let's say 90% of Americans was like me. No pre-existing conditions, no health problems that I know of, fairly healthy. I meet my BMI for my age and height. How does a pharmaceutical company, how does a drug company make money? How do they do that? They're incentive, like the system, the structure, the current. This is why we call it a broken healthcare system here in America. We essentially created an incentive structure where healthy populations actually is a detriment to the medical industry. This is why they don't focus on food. They're just like, oh, here's a drug. Oh, you it's hard for you to lose weight. Instead of going to exercise, changing your diet, let's give you Ozempic. Short fixes, shortcuts, right? And it goes back to this left-wing ideology that I talked about, how we have for too long allowed left-wing ideologues to kind of influence and reform our cultural values through Hollywood, through media, through TV. And it's put in the perception of many young people that they rather have self-esteem than self-control. And there's a difference. Self-esteem believes you deserve everything without working for it. You deserve things because you believe you deserve them. That's what self-esteem has been purported to be by the left-wing ideology that runs rampant in Hollywood. A woman feels entitled to a good man, and she's perfect just the way she is. But the man has to be 6 foot, 6-pack abs, make 6-figure money, right? There's certain marks that a man has to make, but a woman can just be whatever she wants. She can be fat, overweight, look like Lizzo, but she deserves a ripped, tall, handsome man who makes a lot of money, but she's perfect the way she is, right? And this is how you get all this. That's the self-esteem culture. Self-control culture will tell that same woman, hey, you're fat, you're overweight. Most likely, you're going to get a fat and overweight and not so handsome guy. Because that's what you present, and usually that's what you should get. You don't get what you want. You get what you deserve. If you never got that guy, it's because you probably don't deserve that guy. You need to do more work on yourself. That takes self-control to admit that. It takes self-control to be self-critical of what you're doing. And that's something that Democratic Party and many of their supporters lack in spades. Because when they get called out for the misinformation that they push out, when they get proven wrong, they don't humble themselves. They ignore it and press on. They press forward. Oh, no. Don't bother with the fact that our liberal pundits actively downplayed, gaslight any American that questioned the health of Joe Biden. No. Let's forget all about all that. Let's just press forward. We're talking about Trump now. Let's move on. Because they don't like to be held accountable. That's self-esteem. That's the product of self-esteem culture. Because at the end of the day, like self-esteem is very fragile. It gets hurt very easily when reality shows them that they're wrong. Self-control would be like, I was wrong about this issue. Like Jake Tapper's going through right now. And even then, he's making money off of this. So, take that with a grain of salt. But the expectation is I have to reevaluate how I approach things. And Democrats have not even hit that point yet. And they expect to win 2026. Please, America, let's not reward this party, right? Because I know a lot of people are complaining. My guy, Von Swoll, I know he's complaining about the fact that Republicans, none of the rhinos in the Senate wants to pass any of the Doge cuts. It's a progress. End of the day, politics is a game of inches, not sprints. Sorry, it's a marathon. I don't expect these changes to come in until another 10 years, but at least let's get 1% closer to that desired outcome. I think that's the game that politics essentially is. But let me know your thoughts and perspective in the comment section below. I'll be interested to hear what you guys have to say. Don't forget to like, comment, subscribe. Please share this video if you feel so inclined. It really does help me out in the algorithm, and I'll catch you guys on the next one. Peace.